And I've been dealing with some nagging injuries over the years. My legs were stiff, and I thought mostly it was just because of my lack of discipline and stretching, and I was a little embarrassed, but I thought, well, maybe these guys can do something for me. And they had the, what encouraged me, I saw the pictures, they were both athletic like I am. I could tell that they were involved and engaged, and I knew that they had they were staying current with their profession. So we sat down, Ryan and I did, and I explained to him what was going on, and then I explained to him what I wanted to be able to do in terms of some of my goals long term, which was to be able to be more holistic in some of my training, because some of the issues I was experiencing were limiting my ability to train at a level I wanted to train at. So we kind of sat back and said, okay, well, why don't we start dealing with checking out range of motion? And so we just did a very methodical process of looking at how to move me down the road towards some of my own goals that I wanted to accomplish in the gym. Range of motion for me, in some cases, it was so embarrassing. But Ryan was so good about not laughing at me. I'm surprised sometimes that we could keep a straight face. He would say, "Can you do X?" And I'd say, "Are you kidding?" And and I would try to do it, and it would just either hurt. I just couldn't do it. And then a month later, after just a few sessions, I'm doing that and then some. And in some cases, it was two days later that I was able to do the exercise or the corrective move that he had asked me to do, and then a week later my range of motion's up. So it's funny, just recently I went to see a doctor to look at some other issues that we needed to kind of work together on, and he was testing my range of motion, and I said, oh man, back in March I wouldn't have been able to turn 2 degrees to the right. He said, really, who's been, and I told him who I've been working with. So what my hopes are for tomorrow are that in a team format between Ryan and Clay, and working with my own physicians, to be able to continue to train at a level that makes sense for my physiology, the aging of my joints, and the ability to do some of the things that I really still want to do. I'm still able to compete, and why not? But I can't do that without a team of people to help me get better where I'm not strong. I think one of my favorite things, though, I want to share, and this is kind of odd. I'm sort of a private person, but here I am doing a video for a webpage, right? But I'm kind of a private person, and a lot of these physical therapy places that I've been to before, you walk in and it's a cavern with training tables everywhere, and there may be 10 or 12 physical therapists and 10 or 12 patients, and you're talking to this one therapist. They're asking you questions. Sometimes they're kind of personal and private, and for me, it's not very conducive to being open. And I feel like for my healthcare purposes, being very transparent with the people that are working with me is critical. And so I really like the fact that it's quiet, private. We can have a conversation about things that are affecting me. Like if I have a stressful week at work, sometimes it will create issues for me in some of the areas we're working on. I don't want to tell everybody that, and I don't want to tell 15 people in a cavern what's going on in my life. It's none of their business. But if it's relevant to my healthcare needs and to my physical therapy needs, I want to be able to talk about it. And that's one of the great things. And I think feeling like we're a team, have a bad day, come in, I'm really stiff. The next day, maybe 2 days later, it depends, I'll get a text or a phone call or an email, hey man, I want to check on you, how you feeling? Are you better? Because some days I come in and I'm great, and some days I come in and it's like I can barely walk, and then 5 minutes with them and I'm great. Like I came in this morning, I was hurting, and here I sit, 30 minutes later, I'll have a great day now. And that's really what it's all about, is about opening up the possibilities for my lifestyle to do the things I want to do, that I should be able to do at my age.